Hello everyone, welcome to our new podcast today. If you play sports, exercise, or just love staying active, your knees are your most important joints. Today we have Dr. Sidharth Singbal, orthopedic surgeon from Margao, to answer the most common questions about knee injuries in sports, treatment options, and recovery. We will also burst some myths that could be putting your knee at risk. Thank you, Dr. Sidharth, for joining us on Viewbox powered by Radiance Diagnostics.
Thank you for having me on the show.
Let's start, sir. Why is the knee joint injury most common in athletes?
So the knee is a very complex joint. It usually takes the whole weight of the person's body, as well as it absorbs the shocks when the patient is conducting sports. There are a lot of important structures in the knee, specifically the ligaments, cartilage, cushions, which are also called as menisci, and tendons. Because the sporting activities include pivoting and twisting activities, all these structures can get damaged during a sports.
Which knee injury do athletes face the most, sir?
So the commonest injuries that I see in my clinical practice are ACL tears, which is anterior cruciate ligament tears, the medial collateral ligament sprains and tears, the patellar dislocation, which is a kneecap which can come out from the femur groove. Along with that, the cushion tears, which are called as meniscal tears.
Sir, ACL tears sound scary. How do they happen?
Anterior cruciate ligament tears will happen in sudden twisting of the knee or sudden pivoting of the knee, as in sudden stops and sudden turns that can happen because the knee is stabilized by the ACL between the thigh bone and the leg bone.
Okay. Doctor, how will someone know if it's an ACL tear?
In the acute setting, the patient will get a pop noise in the knee, followed by sudden pain and swelling. The patient will feel that the knee is unstable, or it usually gives way and is not able to support his body weight. He will also not be able to continue with the sport that he has participated in.
What's a meniscus tear and why it is so common in sports?
Meniscus is basically a rubbery cartilage which is present between the thigh bone and the leg bone. It absorbs a lot of shocks that pass through while conducting sports activities.
Okay.
During the twisting episode, when the patient is weight bearing and twisting on the knee, the meniscus can tear. Most of the sporting activities includes all these things. So that is why meniscal tears are very common.
What are the symptoms, sir?
In the acute setting, when the patient gets a large meniscal tear, the patient can get something called as locked knee, wherein the meniscal fragment will come inside the joint and prevent the patient from straightening his knee. If they are smaller tears, then the patient can come with usually pain, swelling, and history of locking episodes.
Can your kneecap really slip out of the place?
Yes, kneecap is basically the bone which usually goes into the groove of the thigh bone. If there is a direct impact which pushes it out from the groove, then it can dislocate. The other times when it can dislocate is when the patient twists his upper body on a well planted leg. So of course, knee and patellar dislocations are common.
Not all injuries are sudden. Some happen slowly, right, doctor?
Yes, basically we have seen patients and athletes coming with chronic overuse injuries. So that means the patient's muscles, when they attach to the bone, that connection is called as a tendon.
Okay.
If the patient doesn't warm up properly, if he does sudden exercises, then there are times when this will get inflamed and painful. This can happen over a period of time, and that is chronic injuries. So they do not happen suddenly, but they happen over a period of time. They are called as tendinitis. The common tendinitis which we see in the knee is called as patellar tendinitis, wherein the tendon at its attachment at the tibia bone gets inflamed and sore.
Can we prevent it, or should we stop playing on and off to avoid overuse?
We can prevent it provided we strengthen the muscles around the knee joint. We usually stretch the muscles around the knee joint. We should do proper warming up as well as cooling down exercises. We should not go for sudden exercises, and you should try to do sports specific exercises to keep yourself fit. That is going to prevent this form of injuries.
How do I know when injuries are serious and when should I see a doctor?
Under the circumstances that patient has very mild injuries
Mhm.
or mild tears, then usually the patient would get better on its own between around 3 to 6 weeks. If the injuries get prolonged beyond 6 weeks
Mhm.
and the patient is not feeling all right, then the patient requires to see the physician just to see whether the injuries are major or not. So also if there is pain, constant swelling in the knee, or giving up episodes, locking episodes, or if the patient feels that the knee is not stable,
Mhm.
then he should consult a physician to see whether the injuries are worse.
I see players wearing knee braces and supports while playing without any history of injury as a preventive measure. Should it be like that, doctor?
Injuries usually cannot be exactly prevented with the use of knee braces,
Mhm.
but in some athletes who might be having minor sprains and pain in the knee, they usually wear a brace to see that they feel that tightness around the knee joint. That might reduce the severity of any injury, but it is not entirely preventable.
What's new and how do doctors see what's wrong inside the knee?
In common practice, the first investigation that we do for any patient is taking an X-ray.
Mhm.
X-ray usually tells us about any bony injury or bony ligamentous avulsions. If there is nothing that we are able to make out on an X-ray, then the best modality is MRI, which is magnetic resonance imaging. It usually gives us a very detailed picture of the injuries that the person has sustained. There are two advantages to it. One is that as a doctor, we can plan the surgery very meticulously and can do accurate surgeries. So also there are certain injuries which are not clinically appreciated by the doctor, which can be proven by an MRI.
Does every knee injury require surgery?
All injuries will not require surgery. Minor tears, minor sprains will usually get better with rest, icing, physio, anti-inflammatory medication. Under the circumstances that the injury is slightly more complex in nature and is not getting better with all these measures, definitely they require surgery. But it's not that all injuries require surgery.
Doctor, if surgery is needed, what's the change?
I think in the past, these all surgeries were conducted in an open manner. They were called as open surgeries. But with the advent of technology, with science progressing more and more, we are doing this more arthroscopically.
Okay.
So arthroscopically is basically a keyhole surgery where smaller incisions are made, smaller stab wounds are made. So the surgery becomes less painful and the recovery becomes a little faster, because when there is no pain, we can send these patients for rehab faster. So the patient can become active and can start recovering from the injury early.
How long does recovery take for ACL?
In the case of anterior cruciate ligament injuries, we've seen that the recovery can go anywhere between 6 to 9 months.
And what about meniscus tear?
In the case of meniscus tear, anywhere between 3 to 6 months is the recovery period.
Okay. Once injured, how do you prevent it from happening again?
There are many things that the patient can usually do or the athlete can do. One is she should do warm-up exercises.
Okay.
He should also do cooling down exercises. He should do very sport-specific exercises. He can train under a very well-trained physio and a coach. He can use proper cushioned footwears, and he should be playing on fields which are meant for playing sports. Many times what we have seen is that they play on uneven grounds or they will play in paddy fields, and then that is the time when they get more injuries.
Yes.
Also they can use braces while playing. That will help them in preventing a re-injury.
Okay. Can good diet help keep knees healthy?
I think in the diet for the knees or in specific all joints together, we would consider calcium, vitamin D to be very important. And nowadays we also prescribe patients omega-3 fatty acids, which are basically available in fish oils, which are available commercially. Along with that, glucosamine and undenatured collagen is also given as supplements.
Okay.
Besides that, I would say that the patient should be having a good protein diet, and along with that keep themselves very much hydrated. Okay. All these things would be making the knee quite healthy.
We hear about some PRP injections common among athletes. What is and does it really help and for which injuries, doctor?
PRP is called as platelet rich plasma. So the patient's own blood is taken and it is usually centrifuged, and the top creamy portion of that centrifuged blood is taken and injected in the injured portions of the patient's
Does it
joints.
really help them?
It helps in patients in whom the ligament sprains are minor or the meniscal tears are minors.
Okay.
In that cases, PRP injection helps. Patient might require 2 or more sittings of PRP injections, and there are a lot of studies that are going on. So final results are yet to come, but definitely PRP injections are being tried in a lot of athletes. We found good results of PRP injections specifically in tendinitis, such as jumper's knee.
This is mostly found in athletes, no, sir?
Yes, jumper's knee is commonly found in people who have jumping activities such as basketball, soccer, skipping, badminton, lawn tennis.
Okay. Doctor, now it's time to bust some common myths. I will say the lines, sir. You can say true or false, and you can give one line of explanation on each of them.
Yes.
Yeah. So let's start.
Yeah.
Only old or pro athletes get injured.
It's a myth. I would say that unfit athletes usually are prone to injuries.
Once my knee is injured, playing sports is over or limited for me.
No. If the patient has been operated or has been properly treated, the patient can go back to his normal activities as well as sports.
Rest and icing alone heals all injuries, and physio is rarely needed.
Rest and icing definitely helps in reducing the inflammation, also helps in healing. But along with that, physio is necessary so that you can strengthen the muscles around it, stretch the muscles around the painful part. All these 3 things will help in healing.
So, sir, physio, when we need to go to physio, you will suggest like which?
Many times we have seen that the patients directly approach the physiotherapist. I would say that in case if the injuries are not getting better, then they should go to a physician first who is going to diagnose them and then give adequate instructions to the physiotherapist.
Surgery always damages knees in the long run.
No, surgeries are usually devised to keep your knees healthy.
I don't need to warm up. I'm already fit and can skip it before engaging in any sports.
I think all sports are different. So doing sport specific exercises that are warm up exercises are very important. It increases the blood circulation to the muscles, and that helps the patient in participating in that activities.
Overweight people should never play high impact sports like badminton.
Overweight people usually have got chances of developing all these injuries and so also cartilage wear and tear over a period of long run. So I would generally ask them to resist from taking part in high impact sports, but they can definitely take part in recreational sports. So recreational badminton rather than going for competitive badminton.
Footwear have a role to play in maintaining good knees.
Absolutely. Well cushioned shoes with proper arch support help in preventing the knees from getting damaged.
So everyone should wear it, sir, or if they have some problem with the knee?
Yes, everyone should wear it in the sense that I sometimes even tell my patients who get knee pain or are beyond certain age, also developing arthritis, to wear good cushioned footwear.
Okay.
So it is as good for a common person, which is as good as for any athlete.
Any age, sir, when they can start wearing?
No, I think sports is usually done by people of all age. So when they are doing sports, definitely they should be wearing cushioned footwear.
If my knee does not hurt, it's not injured.
There are many injuries in the knees which might start very slowly, and once the pain starts coming and you visit the doctor, it might be a little late. So it's not true to say that if your knee is not hurting, it is not injured.
When knee clicks or locks, it's something serious and may need surgery.
In our practice, we usually say that if it is a painless click, it can be ignored. But if it is a painful click or if the knee frequently locks, then you should visit a physician to find out what is happening.
Arthroscopy surgery is painful with low success rate.
I think we cleared it earlier that arthroscopy surgery is a keyhole surgery wherein very small incisions, stab wounds are made. So it is definitely less painful compared to open surgeries, and the recovery is very fast, and the patient can join his normal duties as well as his sports earlier with a faster rehab.
So, what are the top tips for healthy knees?
My first and foremost tip to the patients would be to keep their weight in control. Second thing is, when you are doing any form of sports, do first a warm up, do good stretching and strengthening of your muscles, do sports specific exercises, use cushioned footwear, and have a good diet. Keep yourself hydrated.
Doctor, can you explain what these mean?
Yes, of course, I can show it to you on the bone model. This is basically the thigh bone, and this is the shin bone. So the joint between this is called as the knee joint. The bone in the front of the knee joint is called as the patella. So when the patella usually is forced out from the groove inside the femur bone, that is the thigh bone, it is called as the patellar dislocation. When we look at the ligaments inside the knee joint, the ligament which I said, anterior cruciate ligament, is basically a ligament which is like a tight rope which usually unites the femur and the tibia, that is the thigh and the leg bone. So when there is a rupture of the ACL ligament, it is usually in this portion. So this is called as an ACL tear. Meniscal or cushion tears are basically the rubbery cartilage that are sandwiched in between the thigh bone and the leg bone. So twisting injuries with the weight will usually cause tear in this meniscus. Lastly, we can come to what we say as tendinitis. Usually the muscles will go and insert into the bone, that is the connection of the muscle to the bone in the form of a tendon. So when there is any inflammation in this area and soreness, that is called as tendinitis. The smooth portion that is there on the either side of knee joint, on the thigh bone and the leg bone, is called as a cartilage. So many times this is the covering which usually gets damaged, and that is what are called as cartilage injuries.
Thank you, Dr. Sidharth, for sharing such valuable insights. And thank you for our listeners for joining us today. Don't forget to like, share and subscribe for more health tips. Till then, see you. Goodbye.